So you got your wisdom teeth out. Now what? In this video, I'll explain what a dry socket is, what your chances of getting it is, how long does it last, and how do you know if you have it. If you stick around to the end of the video, I will explain how to avoid a dry socket and what you can do to treat it if you do get it. So what is a dry socket? Basically, when we remove your wisdom teeth, you are left with a Grand Canyon of a hole. Just kidding. But to you, it may seem that way. What happens is, when that tooth is removed, the blood clot forms. Well, blood fills it and the blood clot forms. And if that blood clot ends up coming out, you are left with a dry socket. And so inside there, food can get in there and bacteria can follow, and they cause what is called osteitis, or inflammation of the bone. So what are your chances of getting a dry socket? Well, statistics show with regular extractions, your chances of getting a dry socket is about 1 in 5%. Unfortunately, with wisdom teeth, your chances are about 30%. Okay, now if you follow the directions or the tips I will give you at the end of this video, you can reduce that risk from 30% to as low as 2%.
So there are risk factors to dry socket. Poor oral health, difficult extractions, birth control pills, and just medication in general can delay healing. Smoking, vaping, and also dipping can delay healing as well. Drinking from a straw. And even if you follow all these directions, you can still get a dry socket. So how long does a dry socket last? Well, literature says between 7 and 40 days, but in my experience, for the most part, after about 3 weeks, it's over with. Well, how do you know if you have a dry socket? So one of the first signs is obviously pain, and that can start between the first and the third day. Okay. Second part is that you can have dull aches, throbbing sensation, and this could be radiating up your ear, to your eyes, to your temple, and even to your neck. Okay. You can also see visible bone, so when the blood clot is out, you can see into the hole, and in most cases, it's actually packed with food, and that's what's actually causing most of the irritation. You can also notice some bad taste and bad odor in there. Okay. And for some people, if it's bad enough, you can have a low-grade fevers. These are some of the signs and symptoms that you will typically see if you do have a dry socket. If you've made it to this part of the video and you find the information helpful, please share and subscribe. And now for the part of the video that you've been waiting for, how you can avoid a dry socket. Okay, what you should do after a wisdom tooth extraction. Well, first of all, keep your activity level to a minimum for the first 7 days. So just chill and relax. The second part is elevation. Okay, do not lay flat on the bed. Make sure you recline. A recliner is the best for that. Okay. Third is stick to a liquid diet or soft foods. What I tell my patient is, if you have to chew it, please don't do it. Okay. Number 4, keep your talking to a minimum. So if you're on the phone a lot, please don't do so, just because when you're talking, you're engaging the muscles, and the tissue could tug on those sutures if you do have them, and if that comes out, you have a dry socket. Okay, what you should not do after a wisdom tooth extraction. The first one is do not smoke, do not vape, do not dip. Those things will increase your risk of a dry socket. The second part is do not use a straw. This is very common knowledge, but don't use a straw for that first 7 days. Okay. The third is keep your physical activities to a minimum. Please do not go to the gym and work out. Don't go for a long walk. These things will increase your blood pressure, and that can increase inflammation inside that socket. Okay. And the last part is do not chew your food. Just swallow it. Just kidding. Don't do that. It's a choking hazard. But keep to a liquid or soft food diet. Okay, so you followed all the directions, you've done all the things you should do and what you should not do, and you find yourself still with a dry socket. So here are some common cures that I'm going to recommend that you do at home that can definitely help you. Okay, the first one is ibuprofen, because swelling is your biggest enemy, and ibuprofen is going to make a difference. Okay, number 2, go to the store and get yourself some clove oil. Inside clove oil, you have what is called eugen. Basically, it's the same medication we use in like dry socket paste, but soak it into a little piece of gauze or like a cotton ball, put it at the dry socket site and bite down on it and leave it there for about 5 or 10 minutes. Third, use a tea bag. So in tea bags there are properties in there that will help with clotting factors, and for some patients it does ease the discomfort as well. Okay. Number 4, use warm salt water rinse. Okay, gently irrigate that area. Number 5, you can also use medicated rinse. Sometimes your doctor will provide it for you, but it's called Paradex or chlorhexidine. There are different names for it, but irrigate the site just like warm salt water rinse. Just be real gentle with it, okay? The other two here will require you to go to the dentist. As I mentioned, you can go to the dentist and they could put a dry socket paste in there, which essentially has eugenol in it. Now, foreign substances in the hole can delay healing, but it does kind of dull the pain. But you can also do this at home. And the last part is they can go in there and re-scrape that hole. But the problem is when you get that to bleed and re-clot, does not mean it's going to get any better. In fact, in most cases, it's like starting surgery day one. So if you're already a week into this, I normally recommend to ride that wave until it does get better. So I normally try and avoid to re-scraping that because I've done that a few times and it really doesn't help. And if you tear the sutures again or that blood clot comes out, you're still going to have a bad time. And rather than taking 3 weeks to heal, you're up to 4 weeks. Now that you're an expert on dry socket and you find this information helpful, please do share it with your friends or somebody who might be suffering from dry socket. Okay. And if you are not getting any resolution with your dry socket, please do contact your local dentist or oral surgeon who may have performed the procedure, and they could probably help you. Again, thank you very much for watching this video. Until next time, take care.